Good afternoon and welcome everybody to our podcast today focusing on ThinkActive and our SafeACTiVE study. I'm extremely pleased to be here with Patrick Rijnbeek from Actief and Alfonso Jimenez from the EuropeActive board and from ThinkActive, our future think tank. I would like to start with asking Patrick and Alfonso to introduce themselves respectively, starting with Patrick.
Hello, thank you for being here. My name is Patrick Rijnbeek. I'm one of the board members of Actief in the Netherlands, and we're trying to keep Holland more healthier, I would say. And we're very busy at this moment with COVID-19.
Great stuff, and great job keeping the sector open in the Netherlands last week. Was very well done. Alfonso, if you would introduce yourself.
Yes, thank you, Andreas. Thank you very much for the opportunity and for inviting us to share a little bit of time with the audience today. I am a professor of exercise science and health at Sheffield Hallam University and Chief Research and Innovation Officer at GoFit in Madrid. I'm a board member at EuropeActive, and I have been appointed as the formal head of ThinkActive, a really innovative and disruptive project by which we try to bring science and evidence to support our active living agenda across Europe.
Brilliant stuff. Thanks so much, guys. We're very pleased to have you with us today, and for our industry to have experts like you at this critical time of our history. On the 30th of September, EuropeActive released our manifesto for the sector's Horizon 2025, thus defining our path and vision for the coming years. The four headlines and primary focus areas of our manifesto is health, digital, community, and standards. And our main topic today, ThinkActive and producing research for our sector, not least in the area at this particular moment in our sector's history on the safety of fitness and exercise facilities. We relate ThinkActive, our future think tank, to the headline of health, which is the first and the main headline of our manifesto, which is about repositioning our sector towards public health and towards being recognized in European society as a public health solution and a public health partner, providing physical, social, and mental well-being in our communities across Europe. And at this specific moment in time, we've asked ThinkActive, our future think tank on fitness and physical activity, to focus on documenting the safety of fitness and exercise facilities across Europe. And the specific study that EuropeActive has launched under ThinkActive is called SafeACTiVE, and it is done in partnership with the Sheffield Hallam University in the UK and King Juan Carlos University in Madrid, as Alfonso just mentioned, where we are gathering data from operators of all sizes across the European ecosystem, big chains as well as small individual operators, on visits and registered or documented COVID-19 cases across our sector. Alfonso will speak much more about that in a minute. And before we get there, we would like to hear from Patrick in terms of the recent study on exactly COVID-19 risk in the Netherlands that was run by Actief, and that I know has been crucial in terms of keeping our sector open during the second wave of COVID-19 that you have seen in the Netherlands. So Patrick, could you please present us a bit with regards to the study that you ran and what the specific focus was and who was surveyed and so on?
Yes, thank you. We are very pleased here that the Dutch companies, fitness companies, are still open. What we also see is that fortunately the Dutch government realizes that it's very important that people keep training and exercising, and I think that's one of the main reasons that the companies are still open and everybody can still train in the fitness in the Netherlands, and it's a very, very big difference comparing to April, May, where fitness was closed and people were only allowed to train outside. So we're very happy with that, and we also think that having the right numbers, facts, and figures is crucial for the lobby. And the conversations we have with the government of the Netherlands. It's slightly open. The number of people in a training room is 30 at this moment in the Netherlands, and the government the main goal is to minimize the amount of people who are together. So it's a big achievement that we can still have 30 in a training room at this moment. Then to the you call it a research, or I call it it's a very practical survey we are doing. We have been conducting research from March last year, including the loss of turnover, number of customers, and cancellation, for example, in the first period of COVID. And now we're asking a number of infections. We recently asked our members about the amount of infections in the Dutch companies, and how often they report to us how often somebody has been infected, and does that lead to a cluster of infection in the Dutch companies. And it's very good news, because we get about 250, 300 reactions from on our survey, and the results are very good. So there are infections, of course, there are infections at the Dutch gyms, but at none of the cases it leads to a cluster of infections, which proves to us, and that's also the signal we gave to the government, that the fitness is not the place where there are people are getting infected. That's at home and outside, I think. So we use this kind of number, this kind of service. We share that with the government to let them know that we're still the companies are very how do I call that in English? That companies are very well aware of how they can keep people safe in their training rooms.
Great. In your conversations, if I may ask, Patrick, in your conversations with the government, have you been looking at the COVID-19 risk of our sector compared to other sectors? Do you have any data?
Yes, but the government is building their own data, and in their data, we're a small piece of a larger group. So, like the bars and things like that, they're one group, and we are a number in the group of recreation, so as they call it. So we can't use the data of the government specifically for our own. So we have to have our own facts and numbers to create our own to see how it's going into with the companies.
Right.
Yeah.
Very interesting stuff. Alfonso, could you please say a bit about first of all, SafeACTiVE, our ambition to create a European think tank for fitness and physical activity, the role of SafeACTiVE, and then the SafeACTiVE study?
Yeah. Thanks, Andreas. But I would like to specifically refer to a statement made by Patrick that I think that is relevant. It's clear that with this second wave of the pandemic coming, people will get infected, yes or yes. One really interesting paper has been published today, in the Mayo Clinic's proceeding, that basically is done by a group of cardiologists, in United States, and the Henry Ford Hospital in Detroit, in Michigan. And basically, the individuals identified that those with a maximal exercise capacity were protected from getting into a hospital as a result of COVID infection, And I think that it's important to recognize that we, the fitness clubs and leisure centers, will not be protected from people getting infected. What is critical is that they will not infect other people within the facilities, and because they are active, the impact of the symptomatology or the risk of complications coming from the disease will be extremely low or not relevant at all. Which means that exercise practice on a regular basis, and last week we had a really good paper published in Lancet as well, is one of the best ways to boost your immune function. So the critical thing is not if we are going to be totally protected from positive cases, both in staffs or in members, because in fact, we in GoFi, we had some positive cases from our staff during the holidays break, or meeting with families or with friends in bars, or we don't know where. The question is if those individuals within the facilities generate an outbreak or not. And the answer is showing that it's not, So I think that the message is really clear, Getting back to the question that Andreas formulated for me, I think that it's really important that we as an industry take this challenging storm as a fantastic opportunity to redefine our purpose and our drive and our mission. Last June, together with my colleagues, Dr. Mayo and Professor Copland, we published our report for a more responsible and proactive health and fitness industry and physical activity sector across Europe. And we identified, if you remember, 4 key pillars, how we want to really become a more responsible and proactive industry. And it was by recognizing the value that we have in society, the economic value, impact one, the social value that we generated, including a significant reduction in healthcare costs, how we contribute to the Sustainable Development Goals of United Nations strategy, and after how we push our boundaries and influence other areas, other sectors and other activities, and of course, government, So in this expected new reshape of our society in Europe, a more individual supporting society, a well-being economy, where we reshape our priorities and we refocus our energy, and we take care of education and healthcare and sports participation, and we address health inequalities. It's important that we, as an industry and as a sector, are able to bring the facts and the evidence. The first publication that we developed within the brand of SafeACTiVE, is this, in which we specifically identified, and we ran just an scoping review based on a number of fantastic recent papers in the area, but basically to recognize that if you are an individual active, there are six critical areas by which your immune function is going to protect you. And this is a clear public health message. It's not that people are coming to the centers to have fun and make friends, which is true and is fantastic. Is that is a result of this fantastic social and emotional positive experience, they will be at the same time improving a number of clinical capabilities, a number of small molecular changes in our bodies that will protect us from this pandemic or any other infection disease in the future. So the message from us and our vision for SafeACTiVE is that it's not only to bring the science and closing this gap between, the research and the publications of what the industry knows about and how we upskill our workforce and how the public will be able to understand. No, the value of this is that we have to champion a strategy that will push and put the evidence up front. And this will bring significant recognition and value to the things that we do. The interesting thing is that there is now interest, first time in my professional life in the industry, that I have been 30 years, a lot of years, that we really have the drive, the interest, and the motivation in all the stakeholders within the industry. And after we have policymakers desperate to find solutions. And we are a solution. We have a significant level of interaction through SafeACTiVE with the Spanish government, national, regional, local governments. And policymakers are today desperate to find solutions to solve this pandemic crisis. We are one of the solutions. We are here ready to help. We are happy to be in the prevention, fully involved in the support, fully involved in the future recovery. And I think it's one of the best things that a government will be able to do today is just support active living, sports participation, and exercise practice. We have the example now with this challenge in the city of Manchester, where the mayor of the city of Manchester is willing to support the industry to get back to deliver the services, and is championing the fight against in this case, the British national government. So there are a number of key elements there. For us, what is important is that we have to move from an opinionative or speculative or, in some ways, partially interested approach to the reality, to facts, numbers, data, and evidence. And technology today will bring us the data. Is giving us the data really fast. We launched our SafeACTiVE study on the 28th of September. We have today collected more than 55 million visits to fitness clubs and leisure centers across Europe. Data from a lot of countries across Europe. 369 reported cases. An infection rate of 0.66 as today. We are hoping to reach more than 90 million visits. But what is clear is that the gyms are not the place where people will be infected, are the place where people will recover from mental health issues linked to the previous lockdown or the anxiety and the stress that they are living today, because, unsecurity jobs, huge impact for the economy, really compromise healthcare provision and capability regarding chronic diseases, cancer, or any other critical health demand today. And at the same time, they will be able to keep active themselves, so they will be effectively protected against the COVID pandemic. So it's a responsible decision for individuals to keep the active behavior, and a responsible decision for policymakers and governments to keep the facilities open today.
So in our last remaining moments, I know that you are hugely passionate about this, Alfonso, and we are extremely happy about that with EuropeActive. But a question for both Patrick and yourself, Alfonso, perhaps starting with Patrick. I know you ran a very successful campaign during the first lockdown, and Actief had this campaign focusing on the positive impact of our sector. Have you prepared, if I may ask, another campaign for this second wave, and which arguments are you focusing on in terms of positively presenting our sector?
Yeah, I think it's very important to keep repeating the message we already have been sending. So we are doing this at this moment in Holland. We also see a group elder who are very they don't like to come back into the fitness. So we like to focus at certain groups to keep them to announce to them that they're safe when they're sporting inside. I think like that. So I think repeating is very important. No new messages, repeating the message we already been sending since I think April, May, so that the fitness is of course a safe place to train. That's very important by us.
Great stuff. Alfonso, what do you think, apart from documenting the safety of clubs, what are the most important arguments to keep our sector open and underline our position in society as a health solution?
One of the key things that my colleagues at EuropeActive and have been building and developing, as a result of the lockdown, is the impact of the overall social value that the sector is bringing to the British economy, and what this means for anyone within society. A couple of weeks ago, Export England released a new report completed by one of my colleagues at Sheffield, Dr. Larissa Davies, and the team of Sheffield Hallam University. But basically what they said is, there is a significant value that is coming from sports participation, increasing perception of well-being, happiness, of course, reduction in chronic disease, reduction in crime, and social conflicts, improving educational achievement for children and adolescents, etc., etc. Claro, if the sector stops, these benefits will stop and will fail down. And the people more affected will not be the people in the upper side of the society, those who are
lower,
wealthy or healthy or with a significant level of income. No, it's specifically to the ones that are in the low level, you know. As a result of the lockdown, there are still more than 35% of leisure centers and facilities that couldn't reopen in UK, you know. And those are the ones that are in the most deprived areas within the country, which means that the message is not just that are safe places and you will not get infected, which is really important, especially as you refer, Patrick, for the aging populations. No, the other message is that we play a significant role promoting quality of life, happiness, healthy living, active living, social and emotional interaction. And we have to keep these assets, this capability available for society. You know, if we crash, we will impact in thousands and thousands and thousands of people across Europe. And this is, to be fair, is not acceptable. Any government should be challenged on those decisions, because it's fair is extremely unresponsible. Second is extremely unfair. And the third one is affecting the more vulnerable people across Europe. And I think that the message is that we are safe, yeah, but we play a significant social value role within society, and we have to keep this, you know, working and open and delivering on this, you know.
So there's a hugely important role for Think Active to play there in terms of documenting the socioeconomic impact of our sector going forward. So thanks so much. We have to wrap up here. So thanks so much, Patrick and Alfonso, for sharing your expertise with us. Again, congratulations on the great work you have done in the Netherlands, Patrick, and the work of Actief has been obviously very effective. So huge applause for that. I would like to say as a final note, of course, thanks to our audience, and please join us again on the 4th of November for our next podcasts with industry experts and I think representation of sector media as well. So please join us again on the 4th of November. Thanks so much. Have a very nice day, and see you soon.